And here to talk more about the medical side of this story is Dr. Timothy Hanna, an oncologist and clinician scientist at the Division of Cancer Care and Epidemiology Cancer Research Institute at Queen's University. Doctor, thank you very much for joining us today.
Thank you.
Well, the type of cancer has not been revealed, but it was discovered during a recent treatment for an enlarged prostate. What does that tell you?
It's hard to make a lot of this. If this is coming from a time when he's had a diagnosis of enlarged prostate, this could be some other cancer that affects the urinary system, like maybe bladder cancer. But really, given that this was incidental, it could be almost anything. Maybe he had shortness of breath during the procedure. They did a chest x-ray and found something there. So still there are a lot of unknowns.
Now, what other types of cancers would show up with something like the x-ray? I mean, that's a fairly typical thing, I've been told, to have an x-ray when you're about to have any kind of surgery involving your prostate. The chest x-ray is fairly normal. What would that show?
Right. So a typical cancer that would show up on a chest x-ray would be lung cancer, though sometimes spread of cancer from another part of the body can also show up on the chest x-ray. We know that among males age 75 and up in the UK that the most common cancers that are diagnosed are prostate, lung, colon, and rectum, bladder, and melanoma. So lung is on there as well as a few others.
And I imagine this was probably caught early, guessing at what kind of medical treatment the king normally gets. I imagine he's one of the best kept persons in the world.
Yes. So this cancer was detected and he's already starting treatment. This is incredibly rapid. I'm sure that this is beneficial for the outcome of his treatment. The fact that this is outpatient treatment and that the announcement says that there's a schedule of regular treatment suggests that there's more than one treatment, which might point to either something like chemotherapy or radiation therapy.
And is his age an issue? Should it be taken into consideration?
We're really fortunate right now that the types of cancer treatments we have are often very tolerable into the 70s, 80s, and even 90s. So the age itself is I would say a minor factor. Important is also just how his health is overall, and if there are any other conditions he has that might affect his ability to tolerate treatment.